So the three important symptoms which we are going to discuss or talk about first is the psychotic symptoms. So we'll talk about important psychotic symptoms. We'll also talk about negative symptoms of schizophrenia. Negative symptoms. And thirdly, we'll talk about disorganization symptoms. We'll talk about disorganization symptoms in schizophrenia. So let's talk about the first set of symptoms, that is the psychotic symptoms. Now often these psychotic symptoms, they define schizophrenia for the general population and also for sometimes many clinicians. So many people, they know about schizophrenia pertaining to the psychotic symptoms, and these are more obvious or these are more dramatic symptoms of schizophrenia. Now psychotic symptoms include two important symptoms, that is hallucinations and delusions. So these are two important symptoms which are included in the psychotic symptoms. It is important to know that now these psychotic symptoms they're not synonymous with the positive symptoms. So earlier the terms were used sometimes interchangeably, but one should know that psychotic symptom is not equivalent to positive symptoms, as positive symptoms not only include hallucination and delusion, it also includes symptoms such as loosening of association, also may include symptoms such as motor restlessness, which now we know are more of disorganization symptoms. They are symptoms of disorganization. So hence we should know that now in fact CTP, Kaplan and Sadok clearly mentioned that psychotic symptoms are not the same as positive symptoms. So the psychotic symptoms include, and of course not restricted to, but these are the two important symptoms, hallucinations and delusions, which we will discuss. Now psychotic symptoms, basically the focus of psychotic symptoms, it increased with the adaptation of some of these psychotic symptoms in the Schneider's first rank symptoms. And also during the same time, we saw benefits of antipsychotics in schizophrenia. So during that time, there was increase in the focus of positive symptoms, and also it was seen that with the advent of antipsychotics, a lot of these positive symptoms were relieved. So the focus on psychotic symptoms subsequently grew from there. But now we also know the cost of these antipsychotics, as a lot of secondary negative symptoms could develop, EPS could develop, and also there was increase in the medical complications with the advent of antipsychotics, which we'll discuss in the management. Now let's talk about the first important psychotic symptom, which is hallucinations. Now again, as we discussed, many of the Kurt Schneider's SFRS are hallucinations, and in fact in DSM-3 and DSM-4, two of the important auditory hallucinations, that is running commentary on person's behavior and voices conversing with each other, these two specific auditory hallucination, which are also part of the Schneider's first rank symptoms, they were given importance or special significance, as it was in DSM-3 and in DSM-4. These two, if they were present, they were sufficient to make the diagnosis of schizophrenia. So a lot of extra emphasis or importance was given to these hallucinations. But now we know that this special focus has been now removed in DSM-5. So earlier, if anybody would have just one symptom of any of these two hallucinations in DSM-3 and in DSM-4, the diagnosis of schizophrenia would be made. But now we know that in DSM-5, if there is only one symptom, we cannot make the diagnosis of schizophrenia. So this special importance to these hallucinations have now been removed. Now, also it's seen that around 5 to 8% of the general population may also experience hallucinations or even delusions such as persecuted delusions. So hallucinations may not be just seen in schizophrenia or other psychiatric disorders, it can also be seen in general population as well. And of course, it can be seen in other psychiatric illnesses. But it is seen that in schizophrenia, there is greater chronicity of these hallucinations than in other psychiatric disorders and as compared to also to the general population. But it should be important to understand that just the presence of these hallucinations does not itself confirm the diagnosis of any psychiatric illness. Okay, as we have seen that even in general population also sometimes hallucinations can be seen. Now, talking about the prevalence of hallucinations, the most common hallucination which is seen in schizophrenia is auditory hallucinations. Then other hallucinations such as visual hallucinations can be seen. Then tactile or haptic hallucinations can be seen in schizophrenia. Olfactory hallucination, person is having a smell, although there is no smell around, but person is able to perceive some smell. Then there may be gustatory hallucinations, and also tactile hallucination, forms of tactile hallucination like visceral and other deep tissue hallucinations, also known as synesthetic hallucinations. Synesthetic hallucinations may be seen. For example, person may report of sensation of burning in the brain. Such type of visceral or other deep tissue hallucinations may also be seen, although these are less researched hallucination. So this is the sequence in which the hallucination may be seen. So most commonly it is the auditory hallucination, which is, although any type of hallucination can be seen in schizophrenia. So now let's talk about auditory hallucination. So auditory hallucination, as we discussed in schizophrenia, these are the most common hallucination. And of course, when we say hallucination, so we've discussed in the phenomenology what are hallucinations. So a simple to understand is hallucinations are false perception without any stimuli. Okay, so there is no stimuli around, but the person is experiencing some perception which to him is as if it is true. So this is hallucination. So auditory hallucination, these are the most common hallucination, and it has been seen in various studies like in IPSS, International Pilot Study of Schizophrenia, it is seen. So these studies also confirm auditory hallucination are the most common, and nearly more than 70% of the patients in schizophrenia, so more than 75% of the patient with schizophrenia may have auditory hallucination. In fact, if we talk about historically, a century back, it was seen that visual hallucinations were more common in London. So earlier, nearly a century back, it was visual hallucinations which were more commonly seen. And also, many times, in countries such as African countries or some of the Asian countries, still you may find patients, with schizophrenia having more of visual hallucination. But now we know in general we say auditory hallucinations are the most common hallucinations. Also, auditory hallucination are the most common symptom of psychosis in a patient with schizophrenia. So we know psychotic symptom, delusions and hallucination. It is seen that auditory hallucination is the most common psychotic symptom in schizophrenia.